So now I would like to cross over to Dr. Paul Chadwick, who joins us from the United States. And I do apologise for the early hour, Paul. I hope you're fueled up on coffee and maybe some chocolate. Paul's an honorary associate professor at the University College of London Centre for Behaviour Change, and he's also a practicing consultant in clinical and health psychology. He works on the development of interdisciplinary approaches to research and practice change in behaviour change, with a focus on chronic self-disease management, public health, climate action, organisational change, and social justice. So I'm going to cross to Paul, who's going to talk about behaviour change and how that enables a learning organisation. Thank you, Paul, and welcome.
All right. So thank you for the invitation to speak. As has been said, I'm Paul. I'm a psychologist by training, and I've had a twin career as an academic and a clinician doing stuff in the real world. Not that academia isn't the real world, it's just a different world. So for the last 10 years, I have spent quite a lot of my time trying to help organizations develop, understand the potential of, and develop their capability in applying behavioral science to effect change. And I'm going to share some ideas that I've developed over the course of that time, and kind of think about and kind of share, what I think might work. So next slide, please. So I'm going to talk a little bit about definitions. Then I'm going to go on to talk about the value of looking at things from a systems perspective, before we then kind of move into using behavior change frameworks. And then I'm going to end by thinking about how we think about behavioral science or implementation science as an innovation in itself, and what we can do within organizations to make enable the take up and spread of these models. Next slide. And yeah. All right, so there's lots of different definitions and lots of different models of learning, what a learning organization is. My definition is really, really simple. It's any organization that can reflect on its activities and adjust them in a timely way to achieve its objectives. Next slide. So I see kind of organizational change really within the as an issue of that. So I see organizations as complex systems. So if you could press, which have these kind of particular qualities, and most organizational problems are arise from the entities that they are as complex systems. So if you click again, you can see here that lots of organization problems are wicked problems, and wicked problems have these characteristics. They involve multiple stakeholders, they straddle interdisciplinary boundaries, there's no perfect solution, and sometimes solutions create new problems, and we kind of end up in a kind of cycle over time. Next slide, please. So if we think about organizational change, and think about its effectiveness, I mean, lots of management theorists in this area are quite skeptical about organization and change management programs, and there's various figures that have been bandied around, but one that seems to kind of last, which I don't think is entirely evidence-based, but is 70% of change management efforts kind of either never make it to the starting block, or they, if they do, they never quite deliver on their promise. And that's certainly kind of, I think the reason why that is because people have not necessarily understood that organizational change is very often behavioral change. And so implementing any change in an organization requires people to behave differently, which means that we need to understand the complex ways in which people influence and influenced by each other, the physical and social environment in which they're embedded, and the processes and structures that make the organization work. And over the years, I've kind of touched on change management models and methodologies, and I've come to the conclusion that despite our best efforts of both camps, change management models and methodologies rarely represent behavior in a way that behavioral and implementation scientists would necessarily recognize. And maybe part of the reason why change management is so hard or doesn't often deliver on its promise is that we somehow need to fill the gap between change management and behavioral science. So I've got some ideas about how to do this, if that can take us to the next slide. So one important way in that we can do that is taking a systems perspective. Next slide. So if we see now I think as behavioral scientists, we've done a really good job at selling the value of behavioral scientists. And one of the myths we've created is that of the kind of what I call the behavioral science unicorn. And what a behavioral science unicorn is an intervention that for very little investment returns a massive return on that investment. Now, behavioral science has been sold on this idea of kind of hunting down the unicorns and slaying them. But I think we need to retire this concept, because essentially these kind of interventions are usually quite narrow in scope. They're usually a form of environmental manipulation. Very often they're default type interventions, which mean that you kind of change the defaults around decision making. So an example of this would be making sure that everybody has to enrolling everybody into a pension as they join an organization, and requiring them to opt out. Another type of unicorn intervention is restriction intervention, such as kind of restricting prescribing practices. Now, these interventions are good. They've delivered lots of useful things, but they have limited value when we think about complex problems. And I tend to work on complex problems, and I'm guessing that aged care is a whole range of complex problems. Or presents a whole range of complex problems. Next slide, please. So to give you an example of a really wicked problem that doesn't respond well to a very simple behavioral intervention is bullying and harassment in organizations. I spent the last 5 years looking at this issue, particularly in higher education, where bullying and harassment is particularly prevalent and harmful. So we've got if you could kind of just click through the rest of the things on this slide. So it's a typically wicked problem. It arises because of organizations or systems. The usual response is to assume that the problem is a kind of knowledge issue, that people behave badly because they don't know any better. And usually what we're doing is we develop a policy, we monitor the policy, and we kind of disseminate that policy through education and training. But usual responses deliver usual outcomes, and those usual outcomes are usually increased awareness of the problem, but rarely change in behavior, and sometimes very often increase in behavior, the problematic behavior, because people become more aware of it. Next slide, please. I think just go on to the next slide. Okay, so one way we can deal with this is by a method called behavior in systems mapping. And what this is a method for understanding behavior within complex systems. It's a qualitative participatory method that elicits understandings of behavior and the things that contribute to it from a range of stakeholders with different experiences and expertises. And it synthesizes that data into a kind of map that helps you understand where in the system to intervene to affect change. Next slide. This is an example of a behavior in systems map, and it's very complicated and busy, and most of them are very horrific. But if you go on to the next slide, you can simplify this complexity. And what you have here is a simplified illustration of that map, which kind of highlights right in the middle the behavior that's problematic that we want to change, which is staff to student sexual misconduct. And if you could just click on the rest. So there we have that. And you can see that interventions that are focused on the individual behavior, the perpetrator, have failed because what they don't address is how that behavior is a product of power and kind of procedure and policy, if you do the rest of the clicking, and cultural norms. So where previous interventions within this particular institution have focused on changing the behavior of the perpetrator, the systems analysis actually led to 28 different recommendations, all for behavioral interventions to bring about systems changes. So I think the point I want to make is that we may be targeting one specific behavior, but in order to do that in a complex system, it may be required to develop and implement a suite of coordinated interventions that are kind of upstream and downstream from where you want the effect to be. Next slide. So, so I'll talk about kind of behavior change frameworks. Not that systems approach isn't a behavior change framework, although traditionally it's been thought of as separate. I tend to think of them as together. Next slide. So if you could just click through to all of the bullets. Okay, so systems analysis helps us understand where to intervene, and it might not always be where we think it is. It tells us that we may need to intervene with multiple roles within different levels of the organization and with different sorts of individuals. But once we know that, behavior change frameworks come into play to help us develop a suite of more effective and targeted interventions. Next slide. So the framework, if you could just click through all of them. So then the framework that we use at UCL is the Behavior Change Wheel framework. It's a synthesis of 19 existing frameworks across behavioral and social sciences. And it integrates a model of behavior, the necessary conditions for any change to happen, which is the green circle in the on the far right-hand side, on the left-hand side, along with a systematic approach to pressing different levers at different levels of intervention, that's the kind of red and the grey rings around the central behavior. It's designed to be a pragmatic approach for non-specialist and specialist application, and that will become important a little bit later. Next slide. So I want to give you an example of what this kind of looks like by talking about something that I think will be familiar to you, which is kind of patient safety. And we're going to talk about particularly about nasogastric feeding. So if you just click through all the things. So in the UK, our National Patient Safety Agency publishes a list of never events, which are serious incidents that cause serious harm, but are preventable. One example of this is making sure that nasal gastric tubes go into the stomach rather than the respiratory tract, because acutely unwell patients, when they're fed through nasogastric tubes, can tolerate accidental intubation of putting the tube into the respiratory system without obvious distress. And if that is not spotted and feeding is commenced, then the consequences are very serious for the patient. Now, at the time this work was done, correct NG tube placement was mainly decided by X-rays. So the tube would be fitted, people would be shipped off to X-rays to be X-rayed, and then feeding would commence. But it is also the case that misreading of X-rays is the main cause of food being introduced in the lung. And a much more reliable method, and a cheaper one, is testing a bit of aspirate at the time that you've put the tube down using a pH strip. So that's more accurate, but it's rarely performed. And the National Safety Alert guidance made a recommendation to use pH testing. Next slide. Okay, so what this graph shows you, this project used a time series approach to understand the impact of a bottom-up behavior change intervention to implementing the national patient safety guidance. So the behavior that was under interest was pH testing being used as a first line method of understanding where the NG tube was. And you can see that levels are very low, typically around 20%. When the traditional approach to implementation, which is hospitals adapting guidance and disseminating through training, when that was launched, it produced an uptick to about 30% of people using pH, but you can see that that pretty quickly returned back to baseline, particularly when the junior doctors rotated in the various hospitals. Next slide. Okay, so the behavior change wheel was used to develop a bottom-up intervention to support the implementation of the pH first guidance. It used qualitative and quantitative data to gather information on the barriers to pH testing using the combi model, which is a very simple model for understanding the necessary conditions for any behavior to occur. Next slide. I won't go through in detail. This was a very complex piece of work, so I'll just summarize here. But what the combi model does is identify the key barriers that need to be addressed. And I'll focus on motivation in the interest of time. One important factor was emotional, in that a lot of the staff doing the pH testing were worried about harming the patients if they got the procedure wrong. And this was something that wasn't really addressed in the traditional approach to implementing the guidance. Next slide. So the combi analysis allows you to develop very targeted interventions to support behavior change. So for example, to address the emotion component of not using pH, the hospital developed a range of screensavers highlighting the harms that come to patients from sending them to X-ray, because people assumed that the X-ray was the safest thing to do, when in actual fact, 50% of deaths are due to NG feeding, related to nasogastric feeding, were due to X-ray misinterpretation. So let's have a look at what that looked like on the next slide, please. So you can see here that the intervention, and this wasn't the only intervention, but you can see here that the intervention is designed to kind of show how difficult it is to assess where an NG tube is, along with this very kind of stark message that 50% of feeding into lungs is caused by misinterpretation of X-rays. Next slide. And here's the results. So the time series analysis enabled us to enable the project team to compare traditional modes of implementation with the behavior change bottom-up approach, and you can see how the intervention really did produce quite a dramatic uptick, producing levels around 70 to kind of 90%. It wasn't perfect, which is the value of time series data. So you can see the junior doctor effect in around January 12 still happens, but importantly, it's not returning to baseline. So I think this shows us that, and what this project shows us is the bottom-up approach to implementation using a behavior change framework can be very effective and is acceptable to staff. Next slide. So I think after, whatever, 10 years of behavior change research, I think we can kind of confidently say that behavior change interventions work. And I think the more interesting question now becomes, how do we routinely embed the practice of behavior change interventions within organizations so that that promise can actually get out there and deliver real impact on a scalable level. So that's what I'm going to talk about next. I think there are 4 models of utilizing behavioral science. There's buying it in, which is often the way that research funding operates, at least in the UK, or you buy in external consultancy. You can bake it into the way that you do things. You can build behavioral science capability through training, or establish an internal consultancy. I'm going to talk about 2 and 4 in the time that we have available. So let's start with baking it in. What does that mean? Well, essentially, it's embedding one or more elements from a behavioral science approach into the processes of an organization. So it may require specialist expertise to set up, but once the procedures are set up, it can be executed on an ongoing basis by non-specialists. There are plenty of examples of this. So the Government Communication Services in the UK uses the COMPI model to gather insights for the campaigns, but it doesn't use the rest of the behaviour change wheel. Interventions that kind of provide checklists for constructing letters to encourage take up of services, are kind of examples of this kind of way of working as well. This is a really valuable way to do things, and I've seen organizations do great work on the basis of this. It's really useful when there's no ongoing access to behavioral science expertise, or little resource other than the pump priming funding that kind of led to the initial project. And it's particularly effective when it's really clear what the behavior is and the role that it plays in the system, and there's no ambiguity or complexity about that. It's less helpful if there's complexity, and obviously this approach is more vulnerable to breakage when organizations change and the staff turnover. It's not necessarily always sustainable in the long term. Next slide. An internal consultancy model is where you develop a dedicated function within an organization for applying behavioral science. I've worked a lot in the UK setting on developing these and kind of supervise and support their setup. Some insights into this model is that it takes time to establish and embed, and you need at least 2 to 3 years of funding to give it a chance to actually deliver on its impact. It's really important to align the activities of the internal team to the organization's strategic priorities. It's really useful to have a mixture of like generic and specialist competencies. Specialist competencies, I'm talking about behavioral science, and generic, I'm talking about some of the things that Sue was referencing earlier around kind of change management, project management skills. What doesn't work is just bringing in a load of recent behavioral science graduates with little or no experience of the outside world. What works really well is training existing health professionals in behavioral science to a reasonably high level and kind of setting them free to do amazing work. What's also important is that this is a dedicated role or a team. What doesn't work is when you just simply give people 1.5 days and on an existing role to do this. It's just simply not enough for this model. A really important function of an internal consultancy is to build capacity. And so training is a core activity. But what we found is that take-up of training by other members of the organization is variable, and it's often lower than predicted. Some different aspects of different parts of the organization pick up different elements, and some aspects are picked up very quickly, like the concept of identifying behaviors as a first step and the COMBI model. But the more systematic approach to developing an intervention based on the COMBI model is often not picked up. And so if the idea is that you would seed fund a behavior change consultancy who would develop capacity in the organization and make themselves redundant, I've yet to see that happen. It doesn't do away with the need for a central team, and you generally do need ongoing access to expertise to support the application of behavioral science. Not always, but on a general thing. And then the last thing I'll talk about is impact. Rightly or wrongly, the onus is on behavioral science teams to prove they have an impact, even when there are many other functions in organizations that have no evidence that they work or return value to the organization. But that's with you, people are skeptical, we have to do that. It's often much harder than people think to evaluate the effect of our interventions and the effect of the unit. So my tip is to always create a logic model for each piece of work that you do and develop a program theory for the unit itself that can guide evaluation. The other thing I caution against is that often evaluation is given to an external team, and by that I mean another team in the organization responsible for evaluation. Very often those teams don't have the knowledge and skills necessary to effectively evaluate a behavior change intervention. So I think it's always worth having, if you're building a team, build in some evaluation resource internal to your behavioral science team as well. Okay, next slide. So, summary. Learning organizations need to be able to change the way people behave in response to an ever-changing internal and external context. Organizations are complex problems, complex systems, and organizational change has all the elements of a wicked problem. System analysis help unravel the issues that make problems wicked, and also help you identify the right levers to press to reshape the system. You then use behavior change models to help develop effective targeted interventions, and there will be a suite of coordinated, most likely will be a suite of coordinated interventions. And I think the next big question for behavioral science is how to operationalize all these models and frameworks that we now use and have proven work, but within organizations to enable us to deliver on the promise we're selling ourselves on. Okay, thank you very much.
Thank you,
these
Paul.
are just slides for the references for the things I mentioned.
Fantastic, fantastic presentation, Paul. Really good. Thank you very much.